So what does gynecological cancers mean? These are the uterine cancer, cervical cancer, ovarian cancer. Sometimes we consider breast cancer also as part of gynecological cancers, but of course, that is dealt differently. So let's talk about cervical cancer. The key to early detection of cervical cancer is getting your routine pelvic and pap exams. So pap screens are important because they capture the cervical cells. Pap screens always sometimes are misunderstood as that they will screen for everything. But pap is only one part of the test for screening for gynecological cancers. Pelvic exam, your history, your symptoms all do matter. So seeing your doctor regularly, whether that most importantly your primary care physician, but also your gynecologist if that's who you've been going to, but keep up with your appointments. So cervical cancer is very slow growing. The current guidelines are to start screening for cervical cancer in your 20s. And the screening is every year or every 3 years if you don't have any high risk factors, meaning that you don't have a first degree family relative with cervical cancer or you don't have any abnormal bleeding. And then to continue on your pap screening up until the age of 65. If we do notice that there is abnormal cells in your pap test, we will refer you to the gynecologist. Definitely also, somebody more specialized than that is a gynecology oncologist, depending on what the results show. Let's talk about uterine cancer. The most important sign for uterine cancer is abnormal postmenopausal bleeding. Anyone postmenopause should not have bleeding unless, and if you do and you're found to have normal tests, then it probably is because of a side effect of menopause with vaginal dryness. But a lot of times we have patients who come in, they do not tell us that they've been having a little bit of blood or a dark discharge, but please do let us know because it becomes very critical. We can capture it and detect it early, and because the outcomes are so much better these days. So uterine cancer is more so detected with pelvic exam and pap screening, of course. If the pap test does not show any abnormal cells or abnormal cervical cells, then we go ahead and we can do ultrasounds. What ultrasounds do is measures the thickness of the uterine wall, and if it looks abnormal, we can have you see a gynecologist who can then recommend you to have a biopsy. The risk of these biopsies is minimal. The outcome is, and the predictive value or the positive value of doing these biopsies is so much greater that we can capture cancers early on. The misconception that fibroids, and when we say the word fibroid tumors, it scares everyone. But most fibroids are very benign tumors. At least the likelihood of a woman having a fibroid in her lifetime is at least close to almost 75 to 80%. Now, fibroids can also cause abnormal bleeding, can cause pain, they can cause multiple other symptoms, but that is where we can do a routine follow-up and follow through with the gynecologist and your primary care doctor on this. But the key is when you're having symptoms later on, closer to menopause age or in menopause, even when you have fibroids and you have abnormal bleeding, please do let us know. The reason it becomes very important in ovarian cancer is because there is a word, silent killer. Now, ovarian cancers, unfortunately, when they're diagnosed, usually are later in their, in our age or later in the stage of the cancer itself. The reason being that there are no definite signs. For ovarian cancer, there are no such signs or symptoms most of the time. Usually, sometimes there is some lower abdominal pain. If you're having any issues like that or increased pressure, please do let us know so that we can do a proper exam. There are tumor markers. What are tumor markers? There are proteins in the blood that are elevated and are tagged to certain types of cancers. Each cancer has its own different tumor markers. For ovarian cancer, the most common tumor markers that can be checked are CA125 and HE4. The beauty of the tumor markers is that they are elevated. Yes, it helps with us for detection or helps with treatment. But the downsides are that only 50% of women with ovarian cancer can have these elevated. The second downside is that they are not very specific to ovarian cancer. They are elevated in multiple other cancers as well. So seeing an elevated tumor marker as a screening is not recommended because of the false positive rate of what it creates, that the labeling of that, oh yes, you have a high tumor marker and hence you could have this. Where tumor markers really help us is if you are already diagnosed with a cancer, and if we're treating you, then we follow through with periodic tumor marker checks to see if there is recurrence or how you're doing with the treatment. So the current guidelines do not recommend using tumor markers as a routine. Can we do both an ultrasound and the tumor markers to improve probably the ability to detect sooner? There are enough studies that have shown that using a placebo, which means not doing anything, or a different test, and doing these two tests, the outcome wasn't any variable. We weren't able to detect anything sooner or treat anything better. So currently, unfortunately also, there is no proper detection method for ovarian cancer. The key is your symptoms, and make sure when you go in for your PAPs, or if you're not asked by your primary care doctor or your gynecologist, typically your primary care doctor at your annual visits, make sure that you take charge. You ask that, hey, when was my last pelvic exam and PAP? And these are the symptoms I'm having. Can we check? Anybody with a first degree and a second degree relative with ovarian cancer, anyone with breast cancer with BRCA genes. I'm sure you've heard about BRCA1, BRCA2. If there is anyone in the family who actually has that positive, or anybody in the family with multiple family members with colon cancer, breast cancer, definitely bring that to the attention of your gynecologist or primary care physician so that we can then keep a closer watch, because then you are high risk. Then we are going to make sure that we are actually monitoring you much more closely for these specific cancers.